Good afternoon. Of course, I would like to thank the organizing committee and, of course, East Lane Corporation for inviting me and, of course, giving me a chance to share my best practice experience and some evidence-based data pertaining to pressure injuries and other types of skin injuries, and also about a very wonderful product that has been with us for quite some time, and it is one of the I think the best advancements when it comes to preventing pressure injuries and others type of skin injuries. And I have uh, been using this product for quite some time, and as a matter of fact, I've been an instrument, one of the instrument that has brought this product into the country for use of the patients here in the Philippines. Now, these are my common disclaimers wherein the content presented in my slides does not necessarily reflect the institution or the company, Eastlane Corporation, and other manufacturers of the products that you may see here on my slides. And they are based on my opinion as a nurse practitioner, and mostly based on my current practice as a wound specialist here in the Philippines. And some of the facts that is presented is based on the recent National Pressure Ulcer Advisory Panel guidelines. Of course, based on this is going to be based on our scientific discussions, and some may be not recommended for off-label recommendations also. Now, my topic is about pressure injuries, skin care protection, and of course, about Sanyrene. So, just a brief background. I've been working at the Stoma and Wound Care Complex Clinic for 12 years now, and one of the few nurses specialists when it comes to ostomy and wound care. Now, an ostomy and wound care center is a multidisciplinary and multi-specialty center that takes care of people who have problems and issues with ostomy, wounds, and incontinence. Now, the key role player here, the very important factor is, of course, the highly trained, skilled, and certified nurses who closely collaborates with different specialties, with the wound specialist doctors, and most of them are surgeons, the attending physicians, and of course to the other allied health personnel who work in the hospital or in the institution who takes care of the patients. Now, based on our uh, practice through time, we were able to, of course, develop certain skill level, competencies, and of course, modalities on how to take care of the patients. And in our center, we treat the patient as a whole, no? Not only the whole of the patient. So we treat the patient holistically. And by doing so, we were able to, of course, create different guidelines and protocols pertaining to prevention of pressure injuries, to surveillance, treatment and modalities, and of course, involving that patient and the family when it comes to patient care. Now, we all know that pressure injury is always a problem, and the common problem is that the reporting may be difficult because we find that when we report certain incidents and occurrence of pressure injuries, we may think that it implies or it reflects the quality of care that we give to the patient. Wherein, if we really take into a look into it, no, or to look at it closely and to have it on a different perception, maybe no, we can have a way on how to prevent these things to happen. So we were able to develop prevention guidelines, and of course, we were able to identify different preventive devices such as skin moisturizers, and offloading devices that we can use to the patients when it comes to preventing such injuries. No? Not only pressure injuries, but also other types of skin injuries. Now, pertaining to the National Pressure Ulcer Advisory Panel, this was pre-pandemic 2019, wherein we were able to revise the current guidelines and protocols. We must not use the term pressure ulcer anymore. No? So instead, we must use pressure injury because it pertains to the current definition of pressure injury. And before, the definition of pressure ulcer is pertaining to the pressure only. No, it is an injury that happens to a bony prominence by pressure. But now the definition of pressure injury is a wound that happens in a bony prominence with pressure, friction, and shear. And at the same time, we always mistaken a pressure ulcer. That's why they uh, they remove that term, or they remove the word ulcer, because of the misconception that we are thinking that all pressure ulcers have wounds, no, or ulcer. So they say injury, because there are certain categories in the pressure injuries that doesn't necessarily have an open wound or broken skin. Now, to be able to identify properly, no, what are pressure injuries, you must be able to know what are the different skin tone of the patient, and as much as possible, if the patient have a lighter skin, most probably the initial stage would be a purplish discoloration, or reddish or pinkish discoloration, wherein if it is a darker skin tone, of course, we might expect a bluish to purplish discoloration of the body, or the area where there is pressure. So before, the term they use is pressure ulcer, or pressure, or sometimes bed sore. We should not use them anymore, but instead we should use pressure injury. And they have classified pressure injury into two, wherein we have avoidable pressure injuries. Avoidable pressure injuries are pressure injuries that must not happen to the patient, or meaning we are liable to it. Patients must not have these pressure injuries if they are well assessed, if the injury is documented, and the team, including the attending physician, has been informed that the patient has a pressure injury. And must not forget that there are certain disclosures that we have made, no, to the patient family. Unavoidable are pressure injuries wherein whatever care or whatever preventive measures we do, it will happen to the patient because of the present clinical condition of the patient. Now, the healthcare provider and the institution is not liable as long as we have properly identified the pressure injury, we have documented the pressure injury, we have informed the attending physician and made certain disclosure to the patient and the family member pertaining to the pressure injury that might happen to them. Now, with all of this, no, there are what we call the 5 prevention tips when it comes to pressure injuries. No, one is of course changing the position of the patient every 2 to 3 hours. Proper hygiene, as much as possible. Avoid using alcohol wipes, but use just plain soap and water, no, to really take off that feces and urine on the patient's perineal area. Proper nutrition, and of course application of hyperoxygenated oil or your Sanyrene every position change or every diaper changes. Now, we must not also forget the use of mattresses and pillow properly. We're in proper positioning of the patient, and offloading is also advised. Now, we can see here the different types of injuries that may happen to the patient when they are confined, especially in a critical care areas. We have, of course, your stage 1 pressure injury, your stage 2 pressure injuries, your incontinence-associated dermatitis, and of course, your medical device-related pressure injuries. Now, you can see that among all of the management that we have here, we can see that there is on stage 1 and in your IAD, we can actually apply your hyperoxygenated oil or your Sanyrene to prevent further damage to the skin. Now, when it comes to IAD, it serves as a skin barrier. So meaning when you apply it on the patient's skin, the feces and the urine will come in contact with the oil and not with the patient's skin. Now, when it comes to stage 2 pressure injuries, we do not really advise. No? There are no studies yet that pertains that on the wound area, it will give a good impact, but on the peri-wound area or onto the surrounding skin of your patient's wound, no, Sanyrene can be applied, wherein it can promote better microcirculation and oxygenation on that part. Now, what are the features of Sanyrene? Of course, Sanyrene is a topical oil composed of 99% hyperoxygenated fatty acids, 60% linoleic acid, and 1% anise perfume. So that's why you can see that there's a difference in the smell, or a distinct smell, when you apply Sanyrene. Actually, it reduces the risk of developing pressure injury by 40%, and moisturize and prevents skin dehydration, protects by reinforcing the firmness of the skin, regenerates by stimulating skin cells renewal, and stimulates the microcirculation on that area. Now, actually, the mode of Sanyrene implies into the moisture that it provides on the patient's skin, especially if for the elderly, no, wherein the skin of the patient, no, cannot produce that much moisture, and it is always dry. And as much as possible, let's avoid applying alcohol or any um, dressings or harmful solutions to your patient's skin, because it may promote dryness, and not only dryness, but also it may break the skin and may further progress into a wound. So Sanyrene moisturize, no, it prevents dehydration, it protects by reinforcing the firmness of the skin and acts as a skin barrier. It regenerates the skin by stimulating skin cell renewal, and of course through oxygenation. And it stimulates the microcirculation on that area. Now, how to apply and how to use Sanyrene is, of course, just one spray will do. No? Applying one spray of Sanyrene on the area of unbroken skin wherein it is at high risk of having skin injuries, and then do not massage but rub gently, no, on a circular motion, using your fingertips until, of course, the oil is properly applied on an equal surface. And you may repeat this procedure on each area, uh, which is at risk, no, every 3 to 4 times a day. But I advise that whenever the patient changes a diaper, or whenever you do diaper change, I advise that you reapply Sanyrene oil. Now, not only to pressure injuries, but of course, we know that diabetic foot ulcer is also a common problem when it comes to us Filipinos. And diabetic foot ulcer is a non-healing wound with a poorly healing partial foot thickness on the ankle of the patient, or it can be manifesting a dry, scaly skin, no, wherein later on it will break down. It would cause an open wound. Now, um, if not well taken care, we all know that diabetic foot ulcer may lead to amputation. And according to data, uh, after 5 years, no, the other leg may be the next one to be amputated. No? So other than that, the skin integrity of the patient is really impaired when it comes to diabetic patient. No? So what do we do? Now, according to some studies that has been done by Sanyrene or by Urgo Medical, and it was published on the Journals of Wound Care last 2021 or just last year, wherein the application of Sanyrene actually lessens the dryness of the skin and shedding of the skin on the patient with a diabetic foot. And you can see it here on the data wherein it has a great improvement. Not only that, but you can see here that the patient with diabetic foot wherein Sanyrene is applied has increased the TCP-O2 values, wherein it greatly impacts the oxygen concentration on the patient's leg. And this is because of the microcirculation factor, which is found on Sanyrene. Now, in summary, turning and repositioning the patient every 2 hours is still best advice, no? And of course, the outcome will be much more better if we have a combination of the therapy. Now we do the turning, we do the repositioning of the patient every 2 hours, and at the same time, we have other therapies that can be combined with it, such as, of course, your offloading devices and your Sanyrene. Now, the use of mechanical assistive devices for offloading and, of course, your hyperoxygenated oil is very effective in promoting good microcirculation by improving the TPCO2 levels on the affected area. Now, we know that oxygen is very important when it comes to healing, no? And because we provide good oxygenation level at that area, wherein there is a less percentage. No? Now, the JIP study also states that Sanyrene can reduce the incidence of pressure injuries by 53%. This is just last year, no? So just an update. No? And Sanyrene can also be used by improving the skin integrity of patients with diabetes and those who are at risk of developing diabetic foot ulcer. So Sanyrene can be used both for diabetic foot ulcer skin care integrity and, of course, for preventing pressure injuries to your patients. And I think that is all. Thank you very much and have a nice day.